It's another day with the physicians where your health is our business.
The growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when the pressure is high that you have glaucoma.
And I don't know about any other one, but what is your...
You're welcome back to the training also on your regular program. Uterine fibroids are non-cancerous growths of the uterus that often appear during childbearing years. Fibroids range in sizes from seedlings undetectable by the human eye to bulky masses that can distort and enlarge the uterus. One can have a single fibroid or multiple ones. In extreme cases, multiple fibroids can expand the uterus so much that it reaches the rib cage and can add weight. On today's episode of The Physicians, we will be discussing uterine fibroid, the types, presentation, the causes, complications, and of course, management. Stay tuned, don't go away. It's another day with The Physicians where your health is our business. Today we'll be talking about uterine fibroid. If you are just joining us, we're talking about uterine fibroid. Something that is very, very sensitive, and most women don't even want to hear about it. Even the men don't want to hear about it. If they want to marry, they'll ask, do you have fibroid? Does it run in your family? Like, seriously? Well, we'll be talking more about uterine fibroid, the causes, the risk factors, the presentations, and of course, complications when you have a fibroid. My name is Dr. Martina Agbere. And as usual, I'm not alone. I have my co-host with me, very elegant, always smiling. I remain Dr. Memuna Yusuf Kadri. Welcome to The Physicians, your favorite and regular health TV talk show, where your health, of course, is our business. It's always our business. Now we're talking about uterine fibroid. Today we'll be talking about uterine fibroid. Yep. And in the introduction, we mainly talked about the size.
Yeah, the size matters.
It matters. It's such a way that you even think the person is pregnant.
Yeah.
And some women really assume, they believe that they are pregnant. Yeah. And unfortunately, when they go to some places, they tell them it's actually pregnancy.
And those are some of the myths we want to help demystify and also create awareness. There's so much secrecy about fibroid that people don't want to talk about. Recently on social media, there have been some young ladies are sharing their stories regarding fibroid and how, you know, in quotes, as I'm going to say it, in quote, health and wellness experts, you know, those people that do like 1 or 2 weeks courses and then they now claim I'm a coach, I'm a this.
That is the thing now. Coach.
And so one of them who was sharing her story was talking about how that person kept talking about, you know, don't take this medication, don't go and see the doctor, do this, do that, the fibroid will go away. And it never went away until she went under the knife. So it's key that people understand that, yes, not everybody will have fibroid, but if you have fibroid, it's treatable. Even there are newer technologically driven ways now that you don't have to be under the knife. So let's normalize this conversation so that people can be encouraged to seek help from the right people, the right places, and of course the right time.
Well, we have a consultant coming to handle this particular topic, the uterine fibroid. Don't go away, we'll be back after this short break. Stay tuned. back. If you are just joining us, you're on to your regular program, The Physicians, where your health is our business. Today we'll be talking about uterine fibroid. And in the studio, we will have a consultant, gynecologist, and obstetrician. He is a professor. He's done a lot of research, and he's still doing researches all over, even in South Africa, and on our own local place here in Ekiti State. I don't want to say it's a local place. It's actually a place that, at least I know very well that when you take yam and all those, you have twins coming from Ekiti. I'm sure he's also doing research on that aspect. Let's see how it comes on. He is Professor Akinloye Bamigboye. Prof, you're welcome to our program.
Thank you, Mrs. Editor. Fibroid may present in a bleeding format. People do bleed. You have a fibroid, your menstruation is irregular, your bleeding is scatter. It's like a train. So that's why it's called metrorrhagia, menorrhagia. Metro, like a metro line.
Wow.
Regia, like too much. Metrorrhagia. That's what it's called. And then so it's quite in order for somebody with the fibroid to bleed. One. But they do also have pain as one of the symptoms. They do have pain when they are, especially when they have their periods. They do have pain.
Before you even go to telling us the symptoms and the signs, what are uterine fibroids?
Yeah, they are abnormal growth. They are non-cancerous, actually. They are non-cancerous growth that you find in the uterus. It's very common indeed. Up to 70% of women who had postpartum done for any or other things were found to have fibroid in the study. Up to 70%, so it's quite common. And in women presenting with fertility, more than 10% of them will complain. You find fibroid in them, 10%. So which means it's quite a common thing.
So that means that we have this 70% is coming back again. And when we talk anything above 50% is quite that means it's common.
Very.
We are talking about maybe 1 in 5 or 1 in 10. That's what it just means.
Yes.
And now this is for women. When we talk about infertility, men and women are combined.
Yes.
But now when we talk about uterine fibroid, it's a factor only in women. So what are the causes of uterine fibroid?
Thank you very much. We don't seem to know the cause, but we know that there are some risk factors.
Okay.
We start with women who have got a family history of fibroid. In the family, they would present most time with fibroid. So we do ask them, do you have anybody? Do you know whether any of your relatives has got fibroid? And they will tell you yes. And if they say yes, you know that is a risk factor. Then women who are obese, again. People who are obese, they have a tendency of having fibroid. So we have that as a factor as well. And then of course, this is not very common, but it is there. If you have had a cesarean section, the chances that you have fibroid and adenomyosis is a form of fibroid as well. It's also high.
Okay. Has the hormone got anything to do with it? Number one. And number two, nulliparous women, those that haven't had any children at all, are they prone to having fibroid also? Because there's this myth around the fibroid. They say women who haven't been able to be pregnant or have infertility cases, the womb is craving to carry something, and in that case just decides to bring up fibroid. So what do you have to say about that? Who are those that are prone to having it?
Generally speaking, people who are old in their reproductive years, they do have fibroid more than the rest. So that's why it's surely advisable to tell women to start their family life very early.
What age are you looking at?
As early as what, sir?
As early as you can start a family from 18. Yes.
Okay, so let's just talk from adulthood to as early as,
yes,
okay.
As early as 18. But when you are reaching the age of 30s, be sure that you're going to have fibroid. Because also in the same study, they found that people who are of the older age groups, maybe 35, 40, they have a very high incidence of fibroid. So we tell people to get married early. Don't delay until you buy all your accessories in the house. Everybody wants a fan, you want a fridge, you want all those things. No, just go ahead and do what you got to do. Because the older you become, the more the chances that you will end up with a fibroid.
What are the types of fibroid? Because you must have different types of fibroid.
Yeah.
What are the types of fibroid? Maybe we want to know that.
Okay, the types of fibroid are essentially 3 or 4 in nature. We have a fibroid that is inside of the womb, the submucous fibroid. That is the most important one because we know for sure that is the one that affects infertility. Then we got the fibroid that is in the muscles of the womb, the one we call intramural fibroid. Those ones, they are there, they also affect infertility. Okay, intramural. Then you have the subserosal fibroid. The subserosal, they are outside of the womb. It really affects it. So when you are doing your assessment, maybe you are doing a scan and you see a submucous fibroid, you are saying straight away, oh, I may have problems with you, or this might be the cause of your problem. So let's see what to do.
Do you need to remove all types of fibroids? If somebody presents with a fibroid, is it in all cases that you must remove the fibroid?
Thank you very much. Surgery for fibroid is called mammectomy. We do remove if it's inside of the womb and within the womb. But if it's outside of the womb, it does not affect fertility, so to speak. But if it's inside the womb, it's mandatory that something must be done. Either the usual treatment procedure or something less aggressive, but it must be removed. If it's within the mammectomy, which is intramural fibroid, it's also pertinent to take it out. So it's only when it is outside of the womb that you can take a risk and say, I will leave this fibroid alone. As long as the inside of the womb, called the endometrial cavity, is free of fibroid. So the intercavitary fibroid must be taken out, so to say.
But we've had instances where you have women that are pregnant, but they have fibroid.
Yeah.
And those are that you have the fibroid that is within the womb. As the baby is growing, the fibroid is also growing. So how do you usually cope with that?
Yeah, that is the one that's going to be intramural fibroid. So they can still have babies. Some of them will still have babies, or the ligamentous fibroid outside, or the subserosal one is outside of the womb.
So you don't have the one that's inside the womb with
fully pregnant. It's so rare to have one inside of the womb. Those ones are called like polyps.
Okay.
There will be polyps. There will be submucosal fibroid. They will not easily allow implantation of the embryo to stay there. They believe that a witch in the village is doing them. They actually go into labor at times. In fact, all the symptoms of pregnancy, they will have it.
How is this possible?
It is because it's controlled by their brain. The brain controls.
So it's mind over matters.
Yes, mind over matters. So the brain controls them. Even they have big boobs, everything comes. The milk is coming out, but there's no baby. I do a scan. We even do a pregnancy test, and we show them there's nothing.
Prof,
believe that
there's a trend that has been ongoing for a period of time, and I'm sure you must have encountered one or two or read about it. This cystic pregnancy kind of thing, where the woman is being taken by a group of I won't be on national TV and say greedy people for whatever reasons they have, and they'll make these women understand that they are going to have babies. They will keep injecting them, taking care of them. At the end of the 9 months, they give them babies. Does that relate to, are people with fibroid more prone to such, I don't even know the name to even call it. Yes, because now if they have fibroid and they are told that this is pregnancy and all that, because now the people are making a lot of money. They pay as high as 2 million, 3 million. At the end of the 9 months, babies are brought to them, and they actually believe that they had this baby.
I think with that one, I think the women want to do that. How did you give birth to the baby? Is it
they are being brainwashed on
CS or normal delivery?
Oh well, I'm very happy that you are bringing this issue up, because it's a very contentious issue at the moment.
Yes.
There are lots of quackery going on, whereby people believe that they are pregnant and they keep on injecting them with all kind of hormones and nothing. And then when it's 9 months, the health provider will go and steal a baby somewhere and hand it over to the mother, and they claim that they have done a cesarean section. They take the woman to the theater, they cut her, then they close it again.
Is it possible for the woman to do this alone without the husband being aware?
Yeah, the husband may not be aware.
And he says that the woman is really pregnant?
They will just tell
I'm traveling or something.
Whatever they tell you is what they will
it's what they want to tell. Exactly.
No, so the men may not be aware, even though it is very, very wrong, because we have done researches in the past, in the 1990s, suggesting that every step of pregnancy antenatal care, the man must be there. Then we have a dollar effect. A dollar effect is when you are in labor, and your man should actually be in the labor room with you, rubbing your back.
Please, this is now really very sensitive. Just hold it there. You want the man to be there with you.
In the theater as well.
In theater as well. You didn't even end at saying they should accompany the woman for antenatal. Now you are taking it a step further to be in the theater with you or in the labor room. I'll tell you something that happened some years back. We'll be back after the short break. Just stay tuned.
I know fibroid, but in Hausa we are calling fibroid carbon chiki. Carbon chiki, that you stay inside a woman belly. You no go allow women to enjoy herself with that thing at all in life.
Well, so where I understand it is a non-cancerable growth in the womb or uterus.
Oh, that one.
Well, I won't say there's a specific reason for fibroid. But I just know that once you are once you are in the age of during childbearing age, that's when most women tend to discover that they have fibroid.
Yes, you would never allow a woman to get child.
Yes, it can be, because fibroid are various types. They are various in sizes. If it's a small fibroid that can be treated through medication, you can shrink it and it will not affect your womb. It will not cause infertility. Like I said, fibroid can be treated through medication. If it's a small one, medication that you can take, maybe some herbs too, you can take it to shrink it. But if it's very large, you have to go to the hospital, then they do surgery to remove the fibroid.
Some people, they are taking traditional medicine, but most of doctors, they are saying they are doing operation for the fibroid. He will die. He will die. If you never treat that thing, you will die.
Yes, if fibroid is not treated, it can cause maybe heavy flow during menstruation and even prolonged menstruation. Maybe, for example, you have seen your period for 3 to 4 days. If you have fibroid and you didn't treat it on time, it can lead to heavy flow. Can even make your menstrual period flow for longer, maybe like 1 week or even 2 weeks, with pains and cramp. So it will affect it. It can also cause abdominal pain and swelling of the legs too. It can cause back pain as well. So once you are uncomfortable in your tummy, there's no way you'll be comfortable. So it can result in a lot of things that medicals will tell you more.
Welcome back. If you are just joining us here onto the regular program, The Physicians, where your health is our business. I'm sure you heard all that was said outside. Our viewers, all of you, what is said outside in keeping up with The Physicians, your views about fibroids. Now the Prof has told us that it's actually advisable for the men to accompany their wives for antenatal. He didn't end at that. He even said even to the theater and labor ward or labor room. Prof, do you think this is actually doable?
Yes, I can.
In Nigeria.
I can tell you, the study that we did was in Johannesburg in the 90s. We call them the dollar effect. The dollar spelt DOULA. Okay. We did a study whereby we put men in a group and the other group there was no women, no men, following up the pregnancy. And then we then found out that those people who had men in labor, the dollars, or support group, either a mother or a best friend with them in labor, the women breastfed more than those who did not. 1, 2. The Apgar score, it means the ability for the baby to cry, to breathe in properly after birth is higher. We found out that the follow-up as well in months down the line, the IQ of those babies were better. So
this should be promoted.
It was broadcast in those days. But I was not in Nigeria, so I didn't know whether I got to Nigeria. But the doctors here must have read it. Maybe they didn't put it into practice, I don't know. But in my practice in Lekki, Lagos, here, there's no theater case that I have that the man will not be in the theater, if possible, to even cut the umbilical cord of the baby.
And so, aside from lifestyle changes, lifestyle modification, what are the other management modalities for uterine fibroid?
Yes, apart from the modifications in lifestyle, we do, as I said, encourage women to fall pregnant early or to start their families early. But then we have medical treatment for fibroid. Then we have surgical treatment for fibroid. Medical treatment is being used, but not popular because of the side effect. So, but let us mention it for the sake of those who want to do a medical. The medical treatment involves the use of hormone manipulators called GnRH, gonadotrophin releasing hormones. We give it to women 3 months, every month for 3 months, or say 6 months. The fibroid will shrink by a percentage of about 30 to 65%, and then they come back for review and we're happy. But then, mind you, also if they want to do artificial reproductive technique, assisted one, then it's going to be inimical to them. So because they may not produce enough eggs. The way it works is it gives them hypoestrogenic state. The estrogen level is low, and the fibroid will shrink because this hormones. This fibroid thing responds to estrogen a lot. So that is one. Then we equally do have non-aggressive operations. We use the use of laparoscopy, laparoscopic mammectomy. We put a hole in the belly button. We start an instrument to see, and then we attack the fibroid. But before it was not in Nigeria, but by 2006 it came from the Israelis, and now it's very popular. Virtually everybody can do it now. So it's been offered in Nigeria. So we do that. So we have a major surgery as well, where you have heavy, big fibroid, the type that you mentioned earlier on, that when it can get to the rib cage, you do a mammectomy. We prefer to do a hysterectomy, really, but most women want their fertility to be conserved, so we opt for a mammectomy. And if you have a big fibroid, many women have died in Nigeria. That one I'm so aware. I'm even a victim of one or two of them, and a cousin, an uncle, an uncle's wife, and so on, an auntie. So they died solely because of the use of blood, and calling people who are competent enough to undo complications. They don't call early enough, so those people do die. We have the one they call ultrasound, high intensity ultrasound ablation, whereby you direct ultrasound into the tissue to kill those tissues, to make them necrotic, and then the fibroid will shrink. But the danger is that if you are going to do an ART, assisted reproductive technique, like IVF, embryo transfer, it's not very good to use that method. Okay.
What are the possible complications of fibroid?
Number one, we have complications from the operation, the anesthetic effect. You give them anesthesia for pain, they react to it, and they die. And then you have aspiration. The intestine is not completely empty. Then you do operation, you anesthetize them again, they vomit, they aspirate it. So they end up with pneumonia. It's called aspiration pneumonitis or Munchausen syndrome. They have that. Then they do have damage to contiguous structures. You have the intestine nearby, you have the bladder nearby, you have all sorts of things nearby. So you can damage the structures that are next to it. So that is a complication. Then we have long-term complications. Things like, oh, I've done a fibroid, I may have cobwebs, adhesions. So adhesions may go ahead to blocking the tube, so that when you want to be pregnant again, there's another problem now coming. The womb is now okay, the tubes are blocked. So that could be another form of complication.
It's very enlightening.
Thank you very much, Professor Bamigboye. It's actually very interesting hearing all this from you. At least one thing that we have to take away from here is that fibroids are non-cancerous. The non-cancerous growths in the uterus of the woman. People can bleed to death, so you need to seek medical advice. But then, why do you want to wait without seeing the doctor? See the expert. The gynecologists, the obstetricians are always there to attend to you. Well, my name is Dr. Martina Agbere. Till next time, always watch the physicians.
Thank you very much, Prof, for this enlightening program. It's always a pleasure having you on board. Don't forget to follow us on all our various social media platforms. And if you want to ever be a guest on our lovely Health TV talk show, we are just a click away. I remain Dr. Memuna Yusuf Kadri. Till next time, stay blessed.
Hello everybody, my name is Yewande Adekoya. I'm a pharmacist, a wellness and a lifestyle coach, and I'm here on The Physicians talking about self-care. Self-care is taking yourself seriously, putting premium on yourself and living an intentional life. Thank you for watching The Physicians.
If they are the ones that are worst affected by the disease, my heart breaks every time when I have to manage.
You can say that again. Yeah. You can say that again.
I've told you before that the youngest patient I've done a hip replacement for was a 15-year-old with sickle cell disease.
And necrosis?
With avascular necrosis.